Namaste everyone. I welcome you all to this Gurubodha session, an interactive session with Dr. M.B. Gururaja sir and myself. Dr. M.B. Gururaja sir is an Ayurveda practitioner. He is my Ayurveda teacher. He is a professor in an Ayurveda institute, and also he runs Develop and Care Ayurveda Treatment Center. He has medical experience in practice and teaching for more than 20 years now. So he can be contacted at Shumoga. He can be consulted with Shumoga. But if you are an Ayurveda practitioner and if you want guidance for him to treat any disease, if you're a patient and if you want to consult him directly, you can go to easyayurveda.com/Guru Raja, Gururaja. So where you can pay fees and request for a consultation or a video appointment with him. Gururaj sir is very active in CMEs and the Ayurveda doctor community activities. So as in my question to Dr. Gururaja sir is that so it is very important not only to be a good practitioner and a good teacher and all, but it is also very important to have a one-to-one interaction with fellow Ayurveda community members through CMEs, seminars directly, sir.
Definitely, that's the legacy which is been shared by our acharyas. That's what they have communicated and they have given guidelines to us. Very clearly, they have mentioned Vaidya Samoha Nissam Shekaranam, Tadvidya Sambhasha Buddhi Vardhananam. So these 2 points are very clearly suggest that meeting a fellow friend and sharing our experiences and listening to their experiences. So definitely it will enhance our experience as well as which gives a boosting knowledge as well as a booster dose for our confidence to practice. So that's the reason, and you want to update and keep update our knowledge as well as the tradition has to fall in line and it has to be taken care of. So continued medical education is one of the part of it.
I mean, one of the things that I really admire about you is that whenever you post a case presentation in a WhatsApp group or whenever somebody asks for your treatment, you are very upright regarding this is the symptoms presentation, this is what I analyzed, and these are the exact medicines and exact treatments that you gave. Some Ayurveda practitioners kind of withhold that. They do not feel it like sharing with others, though it's very unique for you, but unfortunately many people have kind of secretive behavior and they do not want to share.
See, if our earlier acharyas, our gurus, if they have kept these information as a secret one, then we would not have received these things. So they have given for the benefit of the mankind. So then why I don't want to? Whenever I have information, it is my duty to share it and pass it on to the next generation. Definitely, it will not only improve the standard of Ayurveda and the efficacy of Ayurveda, as well as it also improves the importance and even the confidence of the practicing physicians. And definitely, when a person with experience speaks about certain things, definitely it gives a supporting knowledge and it gives a confidence to practice, and the same thing can be imbibed as well as it might be even practiced in their setup. So that type of thing definitely will not only boost their morale, but also it gives a confidence that we can handle any number of cases or any such cases. So that's the reason we need to share whenever the things are there. And of course, if a given set of condition, if I am treating at my place and I am getting result, it is my duty to see that if the same set of combination, if it is somewhere across in other part of the world or somewhere it is been happening, if another doctor also uses the same combination with exactly with the same type of situation, if he also gets the results what I have received or I have developed, then definitely it is a multi-centric trial of the things which is told in Ayurveda. This is one of the important issue that we need to understand. We need to say that, see, I am using these drugs on that condition, I am getting this particular information and I am getting these results. When I am getting these results, why don't you try it at your place, at your condition or your case? If you get the same result, then it is definitely add on to the information. And if in any contrast, if it is there, then we can have once again a churning, and we can even come out with any finer suggestions, corrections or course corrections, what it is. So it's always better that we should have a multicentric trials. So here, this is another method of having a multicentric trial, because if a person or a team is doing a multicentric trial, they may have some coordinated effort, and they'll have some typical type of controls over the population and the selection criteria and all those things. But when these type of very lucidly we are sharing the information with our colleagues and friends, and they are using in their conditions, then there will not be restrictions, and they may take into consideration that when a treating condition maybe slightly varies, then also we'll get some information after treating those type of diseases. So that's why I always believe in sharing, and I don't keep anything as a secret in this. I don't want to keep it, because it has to be passed on to the next generation. Then only the things will be running.
That's so kind, and so kind of you, and kind of ideal role model to follow. And also, when senior Ayurveda practitioner like yourself, when you talk about these medicines and the treatment combination and all, not only it will give us as an idea regarding, okay, I mean, in these diseases, these can be chosen, these medicines can be chosen. It also, I mean, looking into, I mean, as an Ayurveda practitioner myself, when I see a prescription from some other doctor, we can also get a hint regarding why that has been selected. So it's kind of a reverse engineering. So through those medicines and through those treatments, which type of Agni, which type of Kosta, which type of Srotas, which particular organ have been targeted and all. So it's not just the medicine, but it's also kind of understanding giving the information regarding the medicines and treatments will also help us to think, okay, this is not available, so what are the other medicines which have similar ingredients that are available? So it really makes us to think. And also for the new Ayurveda practitioners who come out, even in India and also outside, they know the Samprapti, they know other things, but only one thing that many of us lack is the art of picking the right medicines in the right disease condition. So sharing information with full set of medicines and treatments by seniors helps and encourages the young Ayurveda doctor to pick up the right medicines bravely.
So then definitely that is the reason we need to go for, because in Ayurveda Materia Medica, if you just look into the yoga and combinations, we have got more than 25,000 and above odd yogas, and many of them are not been even touched or explained or explored. So that type of situation we are passing through. So it's our duty to, whenever we are using it, and of course, not always all the type of yogas and combination we do get every places across the globe uniformly. So there may be certain yogas which may be very popular in India, may not be used available in UK, or it may be not be available in USSR, USA, or it may be due to some legal constraints and practice restrictions, where you cannot use a nanomedicine of Ayurveda, and may not be some supplier or shipment is not possible to England or something like that. So there will be a wide range of issues will be there. So that's why whenever we come out with certain drugs and combinations, this is are being used. Always we try to select a Sannikarsha, means one which is very, very near to the situation which is demanding and required. But many times it so happens that the particular combination or a particular company or a particular product is not available. Then we will go for the better alternative, because this concept is also told by our acharyas in the name of substitution. Pratinidhi Dravyas has been explained very long back. When there is a particular drug is not available, we can choose some other drug. So this is a very beautiful concept which is explained in Ayurveda. So we need to understand these concepts, and we need to carry on this legacy, and we need to keep on sharing the information. Then only the things will grow. And similarly, and moreover, in front of a physician, treating physician, a patient is sitting, and that patient, whatever the information passes on to the doctor, it is a first-hand information to the doctor, and doctor will be a right person in front of him to decide which is the best medicine. Whatever the combinations we may choose and we may give a suggestion on all these things, it becomes only a secondary level information. It cannot be exactly the first level information. The first level information has to be decided by using the yukti and the knowledge of the treating physician. Accordingly, he has to select and make a choices. So while choosing it, of course, if some other information is available from the experienced persons or from the books or from the research, definitely that should be taken care of and it should be utilized. So that will give definitely a morale boosting type of material. And sometimes maybe in a complex situation you may using a very beautiful combinations as told by other acharyas or some other treating physician who got success in that particular type of case. So definitely such information has to be used in order to have a success in the treatment.
Yeah, and regarding my small experience with the CMEs and seminars, as my teacher during the BAMS times, you always encouraged us to go to different seminars. I remember attending a Shota conference in Mysore, and this Atrimed had conducted a seminar in Bangalore. So we went with you and you guided us. So we also went to Cochin World Ayurveda Congress #1 in Cochin. And these were the like the, my, we were learning Ayurveda and all, but how to apply it, what are the different areas in which we can go, all those information we were getting through these seminars. We were meeting a lot of CEOs of big companies, MDs, managing directors and CEOs of big companies, established practitioners, celebrity practitioners, to the likes of L. Mahadevan and whatnot. So we were exposed to everyone, and we were, in each seminar and each CMEs gave a lot of confidence, to me. So one word of my advice would be to the budding Ayurveda students and also to practitioners to attend as many seminars and CMEs as possible. And in one of the such seminars in which was held in Bangalore, I was looking into these Himalaya executives and the presenters from Himalaya company who were so elegantly explaining regarding the products and all. And there only I met one of my seniors, Dr. Vishwanath, who was doing MD by Shija Kalpana in Koppa. So through him, I got a hint that okay, it can be done. MD can be done. Even after BMS, I was not sure to get into MD. So with this clue, I met him there, and I got an idea that okay, we can do MD. So all these we may not be in a position to know everything every time. So attending these CMEs and seminars is very helpful to create better ideas in mind, which in future may get matured, and it may drive your career into a entirely a new path.
Definitely. See, when we are able to get the taste the success, definitely it will boost our morale. And soon after that success, when you display those informations and the success stories, automatically there will be a typical type of or similar type of patients flowing in. When you will be exposed to number of cases, and that will increase your experience in handling those cases. So that definitely gives a very good path, and as well as a very good waste for you to create your own space. And that's what we should do it. When we able to do that such of things in a particular diseases, then definitely people will run to us with that type of cases. And definitely that you may become a referral doctor or a doctor with some excellence. And that type of attitude has to be, we should inculcate in the youngsters to develop such things. And of course, being a seniors, we need to share whatever the experience what we have earned. And because we are being blessed with these things from our seniors and our gurus, and that has to be passed on to the next generation. That's what I believe in. So that has to be done. So to do that and to get that information, that is a CME or even some seminars or workshops and symposia, all these that things are very, very essential. That has to be taking place. That's what even Ayurveda has said in the previous times also. The similar types over there, and it is being called as Rishi Parishad. There are 7 such Rishi Parishad has been explained in Charaka Samhita at various places. That's about the conglomeration or the assembly of these acharyas. They sit together and discuss on a particular topic, and they'll do lot of arguments and charcha and all those things. Then ultimately they'll come up with a solid baseline assumption and a complete clear concept about a particular topic. So that's the reason we need to attend CMEs as well as such type of activities. Reading and even participating in research activities or even sharing the information. even publishing the success stories, writing the article in peer-reviewed journal and reading the articles and all these things definitely will initiate the researcher inside us to go for and provoke us to go for new things and a new combinations of diseases as well as a new combination of drugs. So that's the reason we need to understand this. Participating in a CME is one of the important criteria because it not only helps us to increase our knowledge, it also helps and gives an opportunity to share the things and learn the activity. That's the information what we can get it from the CMEs. So it is better, and there are many people are there working in different parts and different areas. Many times so we may not have seen such type of patients in our practice. If we get information, then it boosts us our morale and our courage to treat such type of patients when we get a chance. So that's the reason we need to attend such things, and as a seniors, we need to share the information as easily as possible that the young generation can pick it up in the right sense.
Speaking about the conferences that were happening in the times of Charasamhita, the number of rasas, how everyone came up, their own opinions regarding number of rasas, and how it was concluded that there were 6 rasas. So it's a wonderful thing. Probably we will hear that narration from you in one of the future classes. So coming back to our agenda of the day is the art of case taking. And yeah, I mean, someone, we were talking a lot. I mean, we have talked about case taking in 2 of the previous Gurubodha sessions, but somebody wanted kind of a, real case study. So Gururaja sir has been kind enough to present it. Can you please explain this case and why you wrote all these things, and can you please guide us through this?
See, very important thing is Roginama, that is a name. We need to have identification. So there will be some MRD number, that is medical record registration number, and medical record document number. Then age of the patient has to be kept in mind because it gives a lot of information about the type of Agni you may be and what is the position of doshas in him because he is in Madhyavastha and all these things. Then Linga, that is a sex, age, I mean, whether it's a male, female, and all these type of things. Then Dharma and Jati, here in this case is a Hindu, which gives an idea that whether based on that, many times based on Dharma and Jati, we can try to conclude that there will be, type of his food habits and food patterns and everything can be understood. And of course, his Sikshana means it's his what do you call education qualification. In this particular case, he was a graduate, and business is doing a cloth business, and is located in Shimoga. Then, what was his presenting complaints at the time when he came to me? It was a dry, scaly lesions on the lower back associated with itching since many years. So this is his complaint: dry, scaly lesions on lower back associated with itching since many years, and the lesions are having irregular margin and shape, and some patches are itchier. So he is having a very discrete patches here and there on the back and even the lower limb and everywhere, but it is irregular in shape. It is no regular pattern or uniform pattern. On scratching, the scales easily peels off, leaving behind reddish bleeding spots, and many patches were itchier. So that itchy patch, many times on scratching, it leaves behind the scales easily and becomes a bleeding spots. And also he has a low appetite and a constipation since many months. And he also has painful bilateral ankle joints associated with swelling since 7 years. So 6 to 7 years since that, it's having continuously, there is an aggravation of these conditions. So when I took the details of his, and then he said that he was very almost normal up to 25 years of his age, but later fine day he developed some skin lesions on the back as a spots with itching, and of course on the both the anterior tibial surface bilaterally. He thought it's an allergy and he took some antihistamine tablet over the counter, and that temporarily got relief. But since then, every year, it is slowly the lesions are getting aggravated, and particularly during stressed out times and winter times. So during those times, usually his condition is becoming worst. So this is what is previous things, and then Purva Chikitsa treatment history. Since last 6 years, he has taken several medications as condition is continuously aggravating. So of course, sometimes partial benefits and sometimes no benefits. Then Kulavrittanta, any family history supporting nothing significant, as all the family members are said to be healthy as per his conditions. I mean his history. Then of course, it's a presenting complaint is a very dominantly a skin disease. So I straight away went into for skin pariksha, the twacha pariksha. Then first thing what we need to understand is varna. Wherever that lesion is there, what is the varna of that lesion? So we have got many words which we use in our classical text. That is Krishna, Shweta, Tamra, Aruna, Neela, Rakta, Pita, Harita, Shama. These are the varied colors of black, white, coppery red, and even bluish or even reddish or yellowish or greenish, something even something like that. So all these type of color has been mentioned. So in this case, what are the things I could identify? I have highlighted with yellow. I have highlighted with yellow color. That is, in this case, the Krishna lesions were little bit blackish, and some places it was tamra or with a tinge of tamra. And of course, when the person scratching it and leaving it off leads to rakta varna. And of course, at some places where there is no itching and lesions are not scaly and they have turned into shava varna. So it's a variegated color of Krishna, Tamra, Rakta and Shava. Almost you can say it Mishra Varaniya. So when the color comes like this, and when these things, Krishna, Shava, Rakta, Tamra, all these things are there, we can analyze from these that the dosha involved is either Pitta or Vata. So these are the at first level. Then comes Vistara, how much it is spread. It is a Madhyama. When it's compared to entire is body area, if we check it up, the extension of the spread, it can be taken as Madhyama. Okay, because Alpa Vastu, Madhyama Vastu, Maha Vastu, we say it's Madhyama, somewhat okay. Then what are the sthana? Where it is actually spread all over the lower back, both the legs, below the knee joint. So it is entirely in those areas. Then akara, what is the shape? It is a discrete, variegated, irregular margin, no uniform shape. So it is typically of that nature. Then Swarupa, what type of vrana or something like skin condition is it? It is Ruksha, Khara, Parusha. Very hard to touch and very powdery in nature and dry in nature and Sputana Yukta. Cracks are also seen. So it's a nature of skin. So if you observe that, so it's very clearly Khara, Parusha, Ruksha, Sputana. Typically Vata. All the qualities are generated due to Vata. Then any Pidaka Varnana is there. In this condition, there was no Pidakas. So there is no question of any Pidaka Varnana. So further moved on to that. Then comes Sparsha. By touching, is there any changes are there? It is Ushna Sparsha or Shita Sparsha. So in this case, it was Shita Sparsha. There is no inflammatory signs or Ushnata was not there. And Vedana Purna. There are little bit of pain was there because he used to scratch and that area becomes bleeded and the minute ulcerations and of course some are infected. So that's why there will be pain. Then comes that what type of pain? Pain is alpa. It is not a tivra or madhyama. It's only alpa. So then comes what the category of pain, whether it is toda, beda, cheda, vedana, pidana. In this case, the patient was unable to describe what type of pain it is. So he said there is a pain. So I kept it as it is. Then there is no daha in this case. And srava, when he continuously scratches it, then there is a little bit of srava, that is rakta srava. So that is nothing but any other srava due to disease. It is only after scratching it yields in a bleeding. Then what type of quality of the srava? It is only alpa srava. It is not madhyama srava or bahu srava. It is not excessively oozing. It's only fine bits of hemorrhages. Then of course in this case there is no question of any gandha. And of course kandu. This is one of the important symptom for this he has come. It was a itching, tivra, Kandu is Tivra itching. So it is severe. And Kandottara Raktasrava. When there is a Kandu, he goes on scratching it and there will be bleeding. Then comes any other Lakshanas. Then Asvedana was the one thing. In this type of patient, we see that perspiration takes a back seat, and usually perspiration doesn't takes place in a prominently normal way. So the patient will always say there will be no sweating as such. So these are the lakshanas and these things. So then based on this, what may be the samprapti vigatana, what we can do it. So very typically when you observe the lakshanas, it is a vata, there is a gunatmaka vruddhi, ruksha is there, parushata is there. So it is two important characters of vata. Then similarly, there is a gunatmaka vruddhi of kapha, which leads to kandu, and of course shita. These gunas are there. So when you look at these ruksha, parusha, kandu, shita, and all these things, very typically it is vata, kaphaja, tvakvikara. We can take it as. Then what is the srotas involved? Rasa, that is tvak, rakta, and mamsa. These are the areas where we are getting the information. Then dushya. What are the targeted tissues which have been hampered with these doshas? This is rasa, rakta, sweda, lasika. These are the areas lasika, sweda, rasa, rakta. These are hampered. Then what can be the sroto dushti? We can take it here. We can take it as sangha. There is no ati pravrutti and there is no vimarga gamana, and it is a typical type of blockage for the vata and kapha. So it can be taken as sangha. Then what is the mala which is involved? The sweda is involved because it has to come out, but it is not coming out. So that is a sweda. Then Udbhavasthana, if you think about from where it is happening, the Udbhavasthana is Amashya, because it is being whatever the food he consumes is, and the condition is starting in the form of Ama from the Amashya, and it is Vyaktasthana is Tvak, means skin conditions. And Vyadhi Avastha is, as his own history tells, many years. So it is a Jirna Vyadhi, a chronic disease. Then what is the Vyadhi Marga? It is typically a Bahya Roga Marga. Then any Upadravas are there. Yes, he was having Sandhi Bandhana and Sandhi Rujha. Then what may be the Vavachedaka Nidana? Looking at these Lakshanas and all these things, we can think that it is Kitiba Kushta, Eka Kushta, or Mandala Kushta. But Mandala Kushta comes under Mahakushta and it is Mahasravi, so it cannot be Mandala. Kitiba Kushta is Kina Parusha, this one powdery material will be there. But here Eka Kushta suits Asvedana, Mahavastu, and Kanduyukta. So if you to look into these things, I make this as a Vyadhi Vinishchaya as Psoriasis or Eka Kushta. Asvedana, Mahaswatu, Mahavastu, and Kanduyukta. So very typically it is Ekakushta. Then other lab investigation in this case was his hemoglobin was 11.5 grams. Definitely when a patient of a chronic skin condition will tend to lose some this one, and even his body, we have observed that hemoglobin level will be somewhat below the normalcy. And another important thing was his RA factor was positive. His RA factor was positive, and ESR is 48 mm per hour and the CRP is 18 mg per liter. So when you look into this factor, RA factor positive and psoriasis, if any modern diagnostic has to be done, then it is called as usually psoriatic arthritis. So usually it is called as psoriatic arthritis. So anyhow, in this case, Patya and Apatya, definitely Supachya, a very easily digestible material, Agni Vardhana, one which simulate the Agni, such Ahara like rice gruel, khichdi, dalia, dal, these basic foodstuffs which across India we use it, that should be taken care and that should be used without any much masala and oil into that. So this is Patya for these patients. And of course, Divasupna and Ratri Jagarana, both are apatya to this patient. Divasupna is day sleeping, Ratri Jagarana is night awakening. Both are not acceptable and it is apatya to these type of patients. Along with that, all deep oil fried items, maida items, fermented items, or spicy foods, All these to be avoided. Even the non-vegetarian diet. Here, there is a assumption. How can we in the Western world, where is a non-vegetarian diet is the staple diet? How can we do it? Of course, I do agree with that. But there are way of making non-vegetarian foods. What I have seen in Indian conditions, most of the non-vegetarian stuffs are cooked in such a manner that excess spice and oils are mixed into that, and it is made at a hot, spicy things. And such hot, spicy non-vegetarian diets are not at all suitable for this condition. Whereas in European and American presentations, sometimes some raw meat is also some with smoked or some baked in along without putting any masala and anything to that. That can be taken care of. That depends on the area and location, and of course the food habits of those patients of that area. Has to keep in mind with yukti, you can analyze whether to give or not to give. So in this case, in the Indian conditions, I have said not to take non-vegetarian foods, as well as even the eggs, pickles, fish are to be avoided. And any whey protein, cheese, curd, yogurt, they're also apatya because they're all abhishandi karaka and they increase the kandu and even this one. Then comes the part of it, as I have decided the psoriasis or the ekakusta treatment part, shodhana chikitsa, because it's a chronic condition. There is a is dosha is of much of higher quality, or the maximum vitiation is there. So I have suggested the patient to go for Vamana chikitsa. So in that Vamana, there is a Purva Karma, Abhyantara Snehapana. We have suggested to him for 7 days in an increasing order, approximately 200 to 250 ml of oil. Grita is consumed. In this case, I have used Panchatikta Gugulu Grita. Started with 20 ml in the morning and goes on increasing day by day, depending upon his capacity to digest it, and followed by empty stomach, and that Ushnajana Pana is also given. Panchatikta Gulugrita started 20 ml net quantity, 200 to 250 ml in 7 days totally, roughly in 7 days. Then comes Bahya Snehana. So Abhyanga with Kutaja Taila and Bruhad Dantapala Taila, we have used this one for 7 days. Then followed by Bashpa Sweda for 7 days. If one sitting, it is just 15 to 20 minutes per session, not more than that. Then comes Pradhana Karma on the 8th day, Akantapana with up to the neck full. I used to go with the Estimadu Fanta and sugarcane juice plus milk as a combination and a rotation, full capacity. Then in between, we may usually give a kalka, which is prepared out of Madanaphala, honey, and Saindavalamana combination. Of course, even sometimes vacha is also added to that. And this will induce a typical Vamana, maybe for 5 times, 6 times, 10 times, depending upon what are the type of shuddhi we need to get, whether it is a pravara shuddhi or avara shuddhi or madhyama shuddhi, accordingly. Then after the proper vegas are over, then usually we go for Haridra and Gugulu Grita Dhumrapana. For the Shesha Dosha Nirahana, that purpose we used to usually do it because it will give a very clear cut suppression to the kapha, which leads to itching conditions. When we do this one, automatically things will be settled down. Then comes the Paschat Karma on the 9th, 10th, and 11th day usually. Depending upon the Agni of the patient, we use it Manda, Peya, Vilepi, Yusha, Kichidi in Samsajana Karma as per the Agni. This Manda is totally rice water. Mande ka rahito, sikte ka rahito manda. There will be not even a single sikta in that. Peya is sikta samanvita. It is a very watery gruel. Vilepi is also comparatively much thicker. Like that, we make a person to use this type of preparations one by one, depending upon the Agni Kala and Agni. Then after once he attain normal Agni capacity and he can be able to consume the normal food, then we follow the Shamana Chikitsa. So in this Shamana Chikitsa, I have opted for this capsule Proskin 202 before food, then Guguratitta Kashaya 10 ml thrice a day after food, Kadirarista 15 ml thrice a day with equal quantity after food, then capsule Atrisor 202 after food, then Kutaja Taila and Brad Dantapala Taila as external application, and Soralin soap for bathing. So this gives a totally package of treatment and a total protocol. And usually with these things, the patient settle down within a 1 month will get very convincing results, as well as even a patient, he will also satisfied and itching will be reduced. And this case, particularly which I discussed now, is in treatment under my treatment for this condition since last 10 years, I hope so. And of course, every winter a little bit aggression will be there, and he go for, particularly he comes with the Sharad Ritu every time, one Virechana he takes, and sometimes in Vasant Ritu he takes one Vamana, and he goes on managing, and he is a very Bishak Bashya patient, and is now the conditions are at most settled, and occasionally now and then he gets some itching, so but it is manageable. So this is the way we can treat any condition with certain pro concepts of Ayurveda, which is explained, and of course, very wonderful drugs which have been explained in Ayurveda.
Thank you very much, sir. Lot of lessons to learn there. So, first one is that you have kind of a definitive framework. So that will help to cover important points, not to forget the points. So having headlines and subtopics well written ahead makes us to think clearly which dosha is getting aggravated, which are the dhatus, etc. So that becomes very important, sir, to have these headings in a model case sheet.
Definitely, if all these, it's what usually I follow in case of skin diseases, which one of the case sheet I have just given for you, because it is a handwritten case sheet. I made it just typed for you people. Otherwise, it will be in a handwritten thing. Everything will be in this format. So this gives us a very clear idea that where to go, what should be concentrated, and what should be taken care of, and how to document the things, and how to that document has to be presented. That gives an idea of course, there is a still lot of scope is there to improvise these case sheets also. One can even improvise based on their requirement.
Yes, and another interesting thing that the history of previous illness and all, like you have written it very detailedly, elaborately as if a story, so that it will be recorded, and whenever we need, we can go back and read it and understand. Sometimes I make this mistake of like writing in a kind of code language in using shortcuts. Sometimes I forget, why I have written what I have written. So clear sentences, patient has explained. So, recording the, history of previous illness and family history and all, it gives a lot of hint towards right diagnosis and right approach for treatment.
Definitely, this is a basic thing need. We have to make it because whenever we come across so many people, scientific community, the basic opening statement what we observe about our science is pseudoscience, and then comes the important thing is that when poorly documented, we don't document our cases. Because of these bombardings I have received through my education time, I have made myself that it has to be documented. So I try to, whenever I get it, particularly skin cases, I'll take a photographs and I'll keep on uploading and keeping in my drives, and that gives me a very good confidence. Even I have many times when I taken with a date will be there, and I'll check with the new and compare it then very clearly, which suggests that how the things are changed over a period of 15 days or 1 month, 2 months or 5 years. So all these things are very interesting, and definitely it is an important medical evidence that we need to keep. Everybody has to follow this, then that will be definitely giving a good scope for establishing our science in a present scenario and present situations.
And also in a typical case of like psoriasis, as in this case, how frequently would you go for Vamana or Virechana? Like once in a year only, or once in 6 months? How frequently, sir?
Usually, once a patient approaches me for the first time, I'll go one or the other variety depending upon the lakshana, which is very highlighted in that particular visit. So based on that, if it is a severe kandu is there, then I will go for Vamana. If it is dryness is there, severe dryness and all is there, then I won't go for any of the Shodhana karmas. Many a times If there is a redness and tamravarna and pustules are also associated with that, in such conditions, I'll go for Virechana. That is one my thought process and of how I do it. Then second thing is, many times it so happens that a patient approaches to me in a particular time of a year. So based on that particular time of a year, I select the Shodhana procedures. If the patient approaches during Vasanta Rutu, whatever may be the condition, then if it is suitable, then I'll go for. If it is a Vamana Yogya Purusha, then I'll go for Vamana Karma. And the patient reaches to me during Sharad Rutu and patient is Virechana Yogya, then I'll go for Virechana preparations. And many a times the patient may not be sufficiently strengthful and even sometimes maybe financially not sound, maybe not interested for Shodhana Karmas, but want to get rid of the itching and all those things. Then they'll ask for, sir, you just give me some medicine for a time being. Let me take a decision to go for Shodhana or not in future. Then straight away, many a times I go for Shamana Karmas, Shamana Aushadis. All these things are there. Of course, that depends on what type of patient mentality and their financial capacities, and everything will count.
Have you ever considered, now you were about to go for elaborate Vamana or Virechana, but patient was not cooperative. So have you ever considered like quick Vamana or quick Virechana?
Sadyo Vamana, Sadyo Virechana, that can be done. Usually, may be done, but I never go for it. If I want to go it for a totally a classical one. And if you are not willing to go for that one, then why you want to go for a short type of or then curtailed way of doing it? Like, thing has to be done according to the classical text, which is said very stringently to get the results. If you are not willing for Vamana or Virechana, then better you take Shamana Aushadis for a longer duration. They also yield the results. It may take some more time. That's the reason.
One of the things that I have observed in you is that you're very clear in terms of whether to go for one thing or not. Like there are no shortcuts or anything. Like in one of the previous classes, you were explaining that, if you give a medicine, patient has to take it. Just because it is proprietary, patient does not have a right to kind of ask you to replace. And even in the case of like Vamana Virechana, will go for full or you will not go. You will go for Shamana. And also in the case sheet, also like there are no shortcuts. Like everything is detailed. So you never take shortcuts and then go for a proper wide approach.
See, very simple reason. If you go for a shortcut, it will cut you short. Many times I have observed if people those who have done that type of shortcuts in some other doctors, they tend to come and say that if I suggested them go for Vamana Virechana, they say, sir, we have already taken, sir. We have been already gone for this, sir. Then I ask them how many days, how you have taken it. Then they will say about this Sadyo Vamana, Sadyo Virechana and all those things. Maybe Sadyo Vamana, Sadyo Virechana to a time being, which gives you a little bit of relief in the symptoms. But if you want, as per my observation, if that in that case and a patient, it is doshik vitiation is too much, then it has to be considered as a bahudoshaja vyadi. Then you have to go for a classical method of shodhana. If you are not interested, then you go for a shamana. Then it may take much more time. That's it. Results will not be there. There is no such hard and fast thing. But the results will be there. But results may be delayed. So if you are ready for such a delay, then go ahead with that. Otherwise, you accept what I am saying, and you should have a belief in me that when I am deciding this one, you should cooperate with that. That's the one, this basic what I expect from a patient. That is Bishak Vashyata. He should follow the instructions given by the patient. I mean, doctor. If doctor says it has to be done like this, if you are willing, you do it. If you are not willing, then don't go it. Go for a Shamana Chikitsa. That's fine. No issues.
And also, this shortcut mentality has seen with some of the Ayurveda practitioners. So if you are keeping on agreeing with, if you are keeping on making the patient comfortable by compromising on our treatment methods or and changing the medicines based on patient's preferences, and if you keep on like shortcutting the panchakarma and all, like over a period of time, it becomes kind of a unwanted habits in the practitioner's mind, which will make him, which will not bring them a lot of success. So that bad habit also needs to be avoided, and we should be like elaborate and following proper protocols.
See, following a proper protocol is with the anticipation of getting a good results. When we are anticipating a good result, we need to follow the things which is told by our acharyas. But many times it so happens that in a practice there are constraints. We do understand that there are constraints, but particularly that the financial constraints many times makes us to avoid these situations, protocols. Of course, Sadya Vamana, Sadya Virechana, I am not against that, but we need to understand that Sadya Vamana and Sadya Virechana can also bring down the symptoms marginally and can give instantaneous some sort of relief. I do agree with that. But why I don't go for such things means these type of cases, these are chronic cases suffering from many years. Why I want to give him a very short period some relief, just to want to show that the Ayurveda works? No, the disease nature is like that. It is tend to remain for a longer duration. Kushtam Dirgha Roganam, all skin diseases tend to remain for a longer duration. Then he is supposed to go for the things which I am suggesting. I try to convince them. So this is the method you have to follow. This is the thing you have to go it and you have to follow it. And if you do it, then there will be result. Otherwise, if you want to have, because recently also one of case which I posted in the TCR of the group, where that female with having a psoriasis, she is taking that medicine since 4 months, but by the time she is already fed up with that, she is not interested to consume the bitter medicines. She is asking me, going on asking me that change to some other medicine, change to some other medicine. I said, I can't. This is the medicine, it has to be consumed in this way. If you consume it, the things will be settled down. Are you not satisfied with the results? She said, yes, I am satisfied with the result. When you are satisfied with the result, then why you don't want to take it? बहुत कष्ट होता है. It is very difficult to take it. It is बहुत bitter है. All these things are. Of course, then I said, see, these are the medicines are bitter, and this bitter principle, that is Tiktarasa, is giving the wonderful result. So you need to take that one. Then she said, I will take it for 15 days. Then by taking 15 days medicine, she will complete those 15-day medicine by 38th day, and then she will delay the things because of this. These are quite common in practice. For that sake, if you are just going on changing the medication and according to their need and things, if you are giving it, then at one fine day, we ourselves will be confused whether I am doing right or wrong, whether the result achieved is real or I say placebo. So all these things will come out of that. So it is better to stick on to our own protocols which we have fixed for these type of diseases. Better to follow it. Any alteration, it has to be yukti purvaka. According to the yukti of physician, treating physician, one has to do it.
So going quickly to the comments here. Yeah, nowadays even webinars are also very helpful. Dr. Savitri ji has written. Yeah, I myself try to, thankfully most of the webinars are uploaded into YouTube. So I try to attend as much as possible. But live webinars, live seminars are way better because it's kind of an experience. We are totally immersed, and it is kind of interactive. And Joe Marine ji has explained, very informative. We'll definitely go back and study the details of the things. So thank you very much for all the participants for your active participation. Thank you so much, Gururaja sir, for presenting the case sheet and guiding us through.
Thank you all. Thank you one and all.